My name is Garry. I'm 35 years old. I live in Phoenix, Arizona. I'm married. I have 2 kids, and I work as a firefighter for the city of Avondale. So I've been a captain for Avondale Fire for 3 years. Well, the role of a captain is to ensure the safety of all of us personnel that are on the fire truck, make sure that they have all the training and knowledge that they need to be able to do their jobs to the best of their ability. Well, I was an athlete all of my life. My identity was to be physically fit. It always was. And next thing I know, I'm dealing with this awful disease where every time I move, it hurts. I have moderate to severe rheumatoid arthritis. It was just like any other day. You know, I went to bed that night. I was feeling a little sore in my back, and my girlfriend at the time, which is now my wife, was rubbing my back, and went to sleep. And I woke up the next morning, and my whole body felt like it was like completely inflamed. It almost felt like I was in a cast of concrete, you know, and I was breaking it every time I moved. I'm also trying out for the fire department at the time. So every morning I had to wake up 2 hours early just so I could get everything moving right. And I kept pushing forward, and I knew there had to be something. I've never even went to doctors very much at all. And I went to this doctor that I was referred to, and they're checking for all these different possibilities, and they sent me to my rheumatologist. So I went to my rheumatologist, and then that's when they took the blood work, and they came back and said that my rheumatoid factor was up, and I definitely had rheumatoid arthritis. When that moment came, you know, I broke down and started crying, and she saw that, and that's when she recommended Remicade. I think the most important part about your relationship with your doctor is being honest. It's not easy to talk about your problems, and sometimes you feel like you're complaining when you're having certain symptoms or you feel a certain way, and just telling them exactly what's going on, how you're feeling. But it also required a lot of input on my part. So a lot of me talking to my doc and telling her, you know, if my symptoms were getting better, if they weren't, and then what problems I was having, and all those little scales they ask you on a 0 to 10 pain scale, you know, and just constantly giving that communication back. And I think that communication with my doctor has really provided the roots for being able to get everything in place. Remicade, for me, the difference it's made in my life. I know that I feel good and my body works, and I don't want anyone taking that away.
Important safety information. Only your doctor can recommend a course of treatment after checking your health condition. Remicade, infliximab, can cause serious side effects such as lowering your ability to fight infections. Some patients, especially those 65 years and older, have had serious infections caused by viruses, fungi, or bacteria that have spread throughout the body, including tuberculosis, TB, and histoplasmosis. Some of these infections have been fatal. Your doctor should monitor you closely for signs and symptoms of TB during treatment with Remicade. Unusual cancers have been reported in children and teenage patients taking TNF blocker medicines. Hepatosplenic T-cell lymphoma, a rare form of fatal lymphoma, has occurred mostly in teenage or young adult males with Crohn's disease, or ulcerative colitis who were taking Remicade and azathioprine, or 6-mercaptopurine. For children and adults taking TNF blockers, including Remicade, the chances of getting lymphoma or other cancers may increase. You should discuss any concerns about your health and medical care with your doctor. What should I tell my doctor before I take Remicade? You should let your doctor know if you have or ever had any of the following: tuberculosis, TB, or have been near someone who has TB. Your doctor will check you for TB with a skin test. If you have latent, inactive TB, you will begin TB treatment before you start Remicade. Lived in a region where certain fungal infections like histoplasmosis or coccidioidomycosis are common. Infections that keep coming back, have diabetes or an immune system problem, any type of cancer or a risk factor for developing cancer. For example, chronic obstructive pulmonary disease, COPD, or had phototherapy for psoriasis. Heart failure or any heart condition. Many people with heart failure should not take Remicade. Hepatitis B virus, HBV infection, or think you may be a carrier of HBV. Your doctor will test you for HBV. Nervous system disorders, like multiple sclerosis or Guillain-Barré syndrome. Also tell your doctor if you use the medicines Kineret, anakinra, Orencia, abatacept, or Actemra, tocilizumab, or other medicines called biologics used to treat the same problems as Remicade, are pregnant, plan to become pregnant, are breastfeeding, or have a baby and were using Remicade during your pregnancy. Tell your baby's doctor about your Remicade use. If your baby receives a live vaccine within 6 months after birth, your baby may develop infections with serious complications that can lead to death. Recently received or are scheduled to receive a vaccine. Adults and children taking Remicade should not receive live vaccines or treatment with a weakened bacteria, such as BCG for bladder cancer, while taking Remicade. What should I watch for and talk to my doctor about before or while taking Remicade? The following serious, sometimes fatal side effects have been reported in people taking Remicade. You should tell your doctor right away if you have any of the signs listed below. Infections like TB, blood infections, pneumonia, fever, tiredness, cough, flu, or warm, red, or painful skin, or any open sores. Remicade can make you more likely to get an infection or make any infection that you have worse. Reactivation of HBV, feeling unwell, poor appetite, tiredness, fever, skin rash, and/or joint pain, lymphoma, or any other cancers in adults and children, skin cancer, any changes in or growths on your skin, cervical cancer. Your doctor may recommend that you be regularly screened. Some women with rheumatoid arthritis, particularly those over 60, have developed cervical cancer. Heart failure, new or worsening symptoms such as shortness of breath, swelling of your ankles or feet, or sudden weight gain. Other heart problems within 24 hours of infusion, including heart attack, low blood flow to the heart, or abnormal heart rhythm, chest discomfort or pain, arm pain, stomach pain, shortness of breath, anxiety, lightheadedness, dizziness, fainting, sweating, nausea, vomiting, fluttering or pounding in your chest, and/or a fast or a slow heartbeat. Liver injury, jaundice, yellow skin and eyes, dark brown urine, right-sided abdominal pain, fever or severe tiredness, blood disorders, fever that doesn't go away, bruising, bleeding or severe paleness, nervous system disorders, numbness, weakness, tingling, changes in your vision or seizures, stroke within 24 hours of infusion, numbness or weakness of the face, arm or leg, especially on one side of the body, sudden confusion, trouble speaking or understanding, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, loss of balance or coordination, or a sudden severe headache, allergic reactions during or after the infusion, hives, difficulty breathing, chest pain, high or low blood pressure and fever or chills, delayed allergic reactions 3 to 12 days after infusion, fever, rash, headache, sore throat, muscle or joint pain, swelling of the face and hands or difficulty swallowing, lupus-like syndrome, chest discomfort or pain that does not go away, shortness of breath, joint pain, rash on the cheeks or arms that gets worse in the sun, psoriasis, new or worsening psoriasis such as red scaly patches or raised bumps on the skin that are filled with pus. The most common side effects of Remicade include respiratory infections that may include sinus infections and sore throat, headache, rash, coughing, and stomach pain. Please see full product information, including boxed warning and medication guide for Remicade, available at www.remicade.com, and discuss any questions you have with your doctor. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.